Hello and welcome to the Canine Rehab Movement Podcast, where we discuss all things canine rehab, fitness, and sports medicine for our four-legged companions. We cover a variety of topics with amazing guests in an educational and entertaining format. Some would even call it edutainment. Now, we are all about canine rehab and fitness training, or craft. So join us and hone your craft with the Canine Rehab Movement Podcast. This episode is sponsored by 1TDC, the #1 veterinary recommended natural supplement for joint and oral health. 1TDC is easy to administer, palatable, and cost-effective while being transdermal and transmucosal, which is why it is trusted and loved by experts around the world, including canine rehabilitation, orthopedics, canine sports and fitness, as well as dentistry. 1TDC enhances mobility and ensures your dog's peak performance and well-being from head to tail. They are now running a promo where you can buy 10, get 2 free, with no mix or matching sizes. So check out the show notes and try 1TDC today. Hey guys, let's welcome back Dr. Deb Gross-Torraca, the owner of Wizard of Paws and one of the founding instructors at Northeast Seminars, who will be joining us today to go over the manual therapy course provided by Northeast Seminars. Now, today she's going to go into the science of it, but most importantly, the art of it. So, Deb, if you could, let's kind of just get right into what the manual therapy course is and what exactly it consists of.
Yeah, thank you so much, Anthony. And this is like a passion of mine. So I'm always glad to talk about it. And with the manual therapy program, I'm joined by Dr. Matt Brunke, Dr. David Levine, and Kirsty Oliver.
Very cool.
So you'll see them in some of the online portion and then the live portions. I'm always there, and then we fluctuate who my guest speaker is.
Yeah.
Which is always fun. To date, we've been having them at my own clinic, Wizard of Paws, up in Connecticut. That's been fun to host, and I asked my clients to bring in dogs, and there's no shortage of them, so it's great for the participants to look at all different shapes, sizes, working, non-working, all of that type of dog.
Absolutely. Very cool to have it at your own place, the comfort of your own facility, knowing how
Yes.
to direct and things like that. That's very cool. Yeah, it almost sounds like you're just missing one from the dream team,
Yes,
Dr.
yes.
Dennis, right? Yeah.
Yeah, so yeah, he leaves that to us, so
Okay.
that's yeah.
Very cool. And you guys do it once a year, usually?
We actually do the labs twice a year. We had a little
Oh,
bit
very
of
cool.
a hiccup with COVID and all of
Okay.
that, but yeah, this is Otter, just he's one of the willing,
Hey, bud.
participants. He
He's trying to
likes
steal the limelight there, I see.
yes, yes, always.
Oh, too funny. Let's get into all things manual therapy, right? You
Yeah,
know, what the basis of the course is, which is principles
yeah,
of canine manual therapy.
yeah.
If you could just explain some of the core principles and the objectives of the course.
Yeah, definitely. And I think I always like to simplify things. We're always touching dogs throughout the day. And manual therapy is one of those things that everyone can do it to different degrees. I always
Mhm.
joke your best tools are your eyes and your hands when we're working with animals because
Definitely.
you're feeling for whether it's heat or inflammation or pain or anything like that. And we know movement to an animal is life. If they can't move any longer, they're not going to be able to function. And whether that's
Absolutely.
in the wild or, of course, domesticated. So often we save an animal's life by getting them to go outside, to eliminate and
Hmm.
all of that. And with manual therapy, we look at it could be something as simple as passive range of motion and then following active range of motion or releasing some of the tissues. So things like massage. Again, a lot of things that we probably find that we're doing a lot. The course just takes all of that and
Yeah.
makes it more detailed. So, for example, while Otter's sitting on my lap, I'm touching him, and whether I know it or not, I'm doing some skin rolling, some myofascial stuff, and feeling all over. But with manual therapy, we're going to use our hands and
Yeah.
use everything that our hands are telling us to determine first what's wrong, if there's any kind of issues with lack of motion, in a joint or maybe
Mhm.
lack of skin motion. Very often, we may not think about a dog that's had abdominal surgery, such as a bloat procedure, and the ramifications that soft tissue tightness may have on the lumbar spine. We can't get the lumbar spine moving unless we get that soft tissue moving. So the combination of both,
Yeah.
and every joint has its designated range of motion, and that may differ a little bit from animal to animal. Some joints have more mobility than others, and we learn first to go over that, what normal is. So, what
Yeah.
normal end feels are like, what they should feel like on different dogs and even cats and that sort of stuff. And then once we understand normal, we can start understanding abnormal. And then
Yeah.
can we restore that range of motion?
Yeah, no, very cool. And I do think a big misconception about manual therapy is always massage therapy, right?
Mhm.
I know when I do my lunch and learns, I ask questions about manual therapy, and that's all they bring up at first is
Yeah,
massage therapy. But
yeah,
there's so much more to it, right? The
right.
stretching and even joint mobilization is
Exactly,
huge, is so huge.
exactly.
But yeah, so no, definitely good points there. And yeah, when it comes to manual therapy, you are looking with your eyes, but you're almost looking with your hands too. I
Yeah,
don't know about your techniques, but sometimes I'm not always looking directly at what I'm palpating.
yep,
I am paying attention to the canine's movements as well, right? If they're looking back at me like, hey, what's going
right,
on back there?
right, like
A lot of times when you're doing manual therapy, I think palpation is huge and your
mhm,
hands are your eyes in some sense. And
absolutely,
you're actually, and just like you were saying, you're doing it right now, right? You're
yeah,
not even looking
right,
and but you are with your
right,
hands.
and you just exactly, and I do the same thing. Owners often think I'm nuts because I'm feeling the dog, but I'm staring at the ceiling, and, one of the things that we do in the live lab is blindfold people,
That's great.
and just learning to palpate different dogs and different sizes and different
Yeah.
breeds and all of that, but yeah. I think people get confused if they're staring at the dog and saying, "Well, the book says that C7
Oh,
should
yeah.
be here. I don't feel that." And our hands never lie. So
It's true, and I think when they're looking at the book, they're only sticking with the science of it, and that's where when we're talking about seeing with our hands, that's where the art comes into play.
right.
It's a learned skill, and the more you're putting your hands on your patient, the better the art of that manual therapy is gonna be for sure.
Yeah, no, definitely. And just like you said, it is an art. And one of my mentors, and I've been honored to speak with him and do projects with him, is Brian Mulligan.
Oh,
And
yeah.
he's hilarious. And the first time I met him, I was much younger, and he had asked me to speak at one of his symposiums, and I remember being as nervous as I could be and thinking, "Oh my gosh, this is like my mentor," and here I'm now in front of probably 3 to 400 PTs and PT assistants, and so I talked about all this, and lots of hands went up, and I remember one person who just recently apologized to me at combined sections when we were up there in Boston. But
Interesting.
he said, "Do you really think you're doing anything if the patient can't tell you about their improvement?" And I was like, "Our patients don't verbally tell us, but they
Mhm.
show us, and they show us functionally. If we've just increased hip extension, that dog is gonna show us by the comfort of moving." And really, this is as functional as it gets because a
Yeah.
human patient may lie and say, "Oh, yeah, it seems to be a little bit better, but it still hurts." And animals don't lie. And
Yeah.
he came up to me and he said, "I'll never forget what you had said." And I was like, "Wow, I forgot about it, but not really." One of those things that kind of
Yeah.
stick
Yeah.
with you. But and Brian Mulligan's always, "Listen, like, you develop your own art and you get the joints moving." And yes, we pay respect to every joint, every aspect of it, and we certainly respect our contraindications and all of that as well, but you develop your art and what is it based on? And of course, your principles, but what's going to work best for you? Do you like to mobilize? When the animal, most of the time, you're mobilizing while they're sitting or standing, sometimes
Yeah.
lying down. They're in a functional weight bearing position and they're going to let you know immediately if you're going into a bad territory, as I say, or
Mhm.
if it's feeling good. So,
Yeah, no, absolutely. I love all the points you brought up. And I think it is pretty interesting where that comment was based out of, because I do actually consider canine rehab very similar to pediatrics. So for me, not every kid or patient, I should say, in pediatrics can tell you, right?
exactly.
But you are going to see their function, right? And I think the biggest communication is body language,
Mhm.
not even verbally, but
Right.
body language. I think that's
Absolutely.
huge. And I guess that was an oversight when they had
Mhm.
made that comment.
Yeah.
But I'm glad, I'm glad they approached you,
Right.
because had they not, would they never would have been educated or things like that. But yes, and the other part that you said is the art of it, right? So we all get taught the fundamentals. And I
Right.
think it's so important not to be so rigid about
Absolutely.
what you're taught. You take that foundation and you make it your own, because you move the way you move and I move the way I move. At the end of the day, it's just the goal of what that foundation is that you're taking and putting it onto the patient.
Definitely. And I often laugh, or I was redoing a chapter in a textbook I had written, I don't know, 20 years ago. And I looked and I was like, God, I don't do it that way anymore. Like, I'm
Yeah.
still doing the same mobilization, but you're absolutely right. Like, I'm very right handed. So that's always my dominant hand. And
Hmm.
the way you mobilize a Chihuahua is much different than a Great Dane. And it is an art. And what's going to work? Like I always say, like the rules, we're never going to do any harm. I
Yeah.
always want to be able to give that animal an out. So if I'm working with them and they need to either move away or step away, they can.
Yeah.
And my body mechanics and the animal's body mechanics are good because certainly we don't want to do anything to ourselves as well while
Of
doing
course.
it. So,
Yeah, you have to protect yourself or
right.
you can't keep going. Right? What would you say is more fun, the Chihuahua or the Great Dane?
Oh, the Great Dane. I think
I knew the answer already.
with the Chihuahuas, I'm always like, "Oh my god," like
Yeah,
reading. I think even if you read their body language, they could still turn around and grab you.
absolutely. I was gonna it's a little more interesting with the Chihuahua, you
Yes.
know?
Ye Oh, absolutely, absolutely.
And segueing into that though, what are some of the memorable cases you've had where manual therapy really improved that canine's health and mobility?
Yeah. So this is funny, but a duck. I was
That's awesome.
working on this duck that had been attacked by a weasel and
Mhm,
had an injury to the back of her neck. And after we helped with the wound healing and all of that, she
mhm.
still wasn't able to get down to the ground to pick up worms. And that was really like one of her functional tasks for just living.
Yeah. Her
You know,
ADLs, right?
yeah, exactly, like her daily living, and I was like, "Alright." So I was like, "Let me look at the facet joint of a duck. What can
Mhm,
we do here? And if I need to mobilize her," and I was thinking in my head the mobilizations with movement by Brian Mulligan. So I was like, "Okay, if we can get her to come down and I can start to loosen up." And
mhm.
so going and she's getting more motion, better motion. I was like, "This is great. So let's work on putting her water," because at that point she still couldn't. I guess ducks, they go down into flexion and they come up to
Mhm.
extension to swallow. The next treatment after that, the rescue facility brought in worms or night crawlers for her to
Yeah.
eat, and I was like, "Oh, okay. This is
Squirmy wormies.
big." And I remember mobilizing her, and she went limp for a second, and I thought, "Oh
Oh,
gosh, what just happened here?" And then she went all the way down, all the way up, and she were earthworms were flying all over the place, and just any like our mobilization, so the goal is always we're gonna follow with active movement. Part of her homework was, okay, let her just eat those worms, get that motion going, and
yeah.
it didn't take much, a few treatments, and she was back and was able to be released, not within the sanctuary and not being hand fed anymore, and I was like, "Wow, that was pretty cool."
That's a pretty cool story.
Yeah, and just, like, trying to, again, think outside the box. Like, some of my favorite mobilizations are on hip dysplasia, especially those older dogs,
Yeah.
because trying to just get a little bit more firing of the mechanoreceptors with
Mhm.
proprioception and, with that, but also help increase their extension a little bit.
Yeah.
And so it's because it's something you see almost immediately. They're walking better and they have more extension. And they're probably like my normal ducks are fun, but they're a zebra in the front. Look at like essentially any joint, and if it needs it, you could definitely mobilize and
Always.
yeah. Well,
Yeah, no, I find even with the straightforward cases, right? Like
mhm,
your TPLO,
mhm,
and then you see that if it's a left TPLO and then the right forelimb is
right.
super tight, obviously you're going to be doing some manual therapy with soft tissue, but
Yeah,
you also want to see if the joint too a little bit.
absolutely.
So
Abs
it's not just the main problem you're looking at here. That's the great thing about canine rehab is
yeah.
there's a functional goal for us and a functional assessment of the patient that comes into us.
No,
So, yeah.
definitely. You look at even same with human athletes.
Mhm.
So maybe 5 degrees of a loss of corporal extension is not a big deal in the Labrador that kind of counter surfs at home, but that
Mm,
could be huge in, let's say, a working police dog or,
yeah.
agility dog or something like that.
Yeah, it's not all cookie cutter, right? There's
No,
so many different
definitely not.
types of functional goals out there for sure.
Yeah.
But yeah, no, I also remember, in my first year, one of my first cases, and this is where it was a feel good moment because I took things that I actually learned in the human PT world.
Mhm.
I went through the CCAT course and I learned a lot, but this was where I was actually implementing some things of Mackenzie. So
Mhm.
I had a long haired chihuahua whose
Mhm.
head got stuck in a headboard.
Oh gosh.
And yeah, and so it was. Hey guys, I hope you're enjoying today's episode of the Canine Rehab Movement. I just wanted to take a hot minute to talk about something that can make a big difference for both you and your furry friends. Now, today's episode is also sponsored by Elevation Vet USA, your go to for veterinary shockwave therapy. The PiezoWave 2 Vet is the leader in treating animal musculoskeletal injuries. It pinpoints injuries precisely, ensuring quicker recovery and less discomfort for your furry patients. Not just good for your patients, but great for your clinic's success too. Discover more at veterinaryshockwaveresources.com. Pulling out, and while it did that, of course, it was in flexion and one of the discs protruded. I went back to the fundamentals of all things Mackenzie, and what was really great because the way the Chihuahua presented was super wobbly. Its front legs crisscrossing, all things like that. But I did that soft tissue work to make sure the muscles were intense.
Right, right.
And then I started to do a distraction,
Mhm,
right? And I was distracting the neck and I was getting some good results out of that. And I said, you know what? Why don't I start going into
mhm.
extension while I distract? And in all of 20 minutes later, I had this Chihuahua walking again. And it was just such a feel good moment because
Mm,
it's those techniques like Mulligan and McKenzie that I think can truly be translated in canine rehab as well.
yeah.
I'm super excited to see that implemented in future canine rehab therapists as well.
Yeah. No,
Yeah.
yeah, definitely. We often think about, like, pelvic mobilizations and,
Mhm.
things like that. We're dealing with a quadruped so much, like you said, with the TPLO and then what could be off
Yeah.
with the forelimb, and it's really I always say, like, my staff probably gets tired of hearing it, but, yeah, we have a primary problem, but what's the secondary, what's the tertiary, and how are we going to treat it? Because you look at all
Absolutely.
the compensations and yeah, definitely.
Yeah. So, what would you say was a challenging case, though? And was there any things that you found finally down the path of a bumpy road,
Yeah.
finally to the finish line?
I've definitely had some of the working canines that, have not been very easy to get to relax,
Mhm.
or it takes longer because they're so on guard and they're like, what are you doing to me?" And that sort of stuff. And a lot of them have lumbosacral things, issues, and we're working on preventing them from
Mhm.
getting any worse or any kind of problems. Sometimes, not always, they can be challenging. One of the Another, like, kind of zebra, we had an alpaca that had hip dysplasia, and I was,
Okay.
"Ugh, okay, this is gonna be interesting," and,
Yeah.
again, like, figuring out how can we do this? How can we, like, mobilize, get some manual therapy in there, and we worked up was mobilizing this alpaca while he was essentially walking up a hill getting extension, and that was, like someone said, "How did you even think of that?" I'm like, "I really didn't until I was behind the alpaca and thought,
Yeah.
why don't I do some mobilizations with movement and he won't really know what's going on." You know?
Yeah.
But yeah.
No, I love that. That's you've got some unique cases, that's
Oh,
for
yeah.
sure.
It's always fun. And, of course, the chihuahuas. How to
Yes.
mobilize them without
Always the
yeah.
chihuahuas.
Yes.
Yeah. Yeah, I was just lucky enough with that chihuahua. It was a long-haired chihuahua. I think it was just in so much pain that it was actually calmer.
Yeah.
I was always on guard, like, ready for this little bite on my hand or
I was
something. It was I think after breaking it down with the massage therapy, it was like, "Save me.
yeah,
Help me."
absolutely. And
Um,
said sometimes too, like, getting them like, I often laugh with those police dogs and getting them to, like, calm down. I'm like, "Okay, I'm gonna whisper sweet nothings to you," and
oh,
she win them
right.
over. They're fine, but always a little bit of a challenge.
Yeah. Yeah, especially first day. First day is always that
Yes,
acclimation, you know?
without a doubt.
Outside of that, how would you say you combine it with some rehab modalities in a comprehensive treatment? Do you start modalities first? Would you start with manual therapy? Things like that.
Yeah, and it's definitely part of that multimodal approach that we look at.
Yeah.
And your times are really, because we're always reassessing what's going on. If there's too much pain, we're going to do modalities first. So
Yeah.
whether that's laser or sometimes shockwave, whatever is going to work to really reduce that pain and inflammation to see, or a muscle spasm if we can get in there. So, definitely in those cases, I'll use modalities first, go in, do my manual work and start at the lowest power, if you will. So maybe
Yeah.
it's just passive range of motion or accessory glides or lower grade mobilizations, and constantly reassessing. And I always like to think of mobilizations. If we've increased that motion, if we can do passive range of motion, then active range of motion, and then send the owner home with an appropriate home program. Um,
Yeah.
some of the chronic, like OA cases, I may do the modalities after mobilization. So if
Okay.
I know that they're okay, they're fine during the mobilizations, but it's typically they'll have discomfort after, that's when
Mhm.
I may employ tactics like laser or have the owner, utilize the laser at home or something like that, working. So,
I know, very cool.
yeah, so really looking and what's gonna work the best.
Yeah, that's the thing, right? Every patient's different,
Mhm.
and even when you think you know them, that next session,
Right.
something could have happened.
Ab
They're responding differently, those kind of things. So, yeah, it's always good to stay creative and
Yeah,
not just, "Okay, we do laser, oh, then
right.
hydro, then"
There's no cookbooks to this.
No, and listen, we all have our defaults. I'm a big fan of, especially before I do manual therapy, I have a class for lasers, so I love the thermal effect of it as well.
Mhm.
It really helps to relax the patient, and then I get a better stretch, massage therapy,
Sure.
things like that. They're just a little bit more receptive. But sometimes, honestly, I I do hydro first. I do underwater treadmill first because it's also got a really good thermal effect. And
Absolutely.
and depending on how the patient is responding to me,
Mhm.
sometimes I'll jump in with the patient and do the manual therapy in the water as well.
Yep.
That's what's really great about that thermal effect of the water. And plus, not every patient's going to just lay there for you. Like you said, sometimes we have to do it in standing, sometimes we
Right.
have to do it in these not so textbook positions. And it's definitely something where you need to be able to read the patient,
Yeah.
see how they are, and be creative. Don't be
Absolutely.
trying to battle on your treatment table or your
Right.
treatment mat. Sometimes you just have to move on and figure out where you can squeeze it in somewhere else.
Yeah.
So I think that's truly important about the art of manual therapy.
Absolutely, and I love that with, in the water, definitely sometimes that, except the Chihuahua. Um,
Yeah.
I often think about those big dogs, and we have
Oh, yeah.
quite a few Great Danes getting ready for Westminster right now, and,
Okay.
we're loosening up, and a couple of them are we need to get their craziness out, so we definitely do the water first.
Yeah.
Well, you
Oh,
know
yeah.
yeah.
So that's a lot of our approaches as well, especially with our agility dogs, things
Yeah.
like that. They're revved up, ready to
Oh
go,
gosh.
right? They see your facility and they're automatically thinking playground.
Yep.
And so if you wanna have them on the treatment table or treatment mat and mostly compliant, you gotta expel the energy that's,
Definitely.
bottled up right there.
Yeah. Oh, without a doubt, I know. So funny.
Yeah, no, I love it because that's what's so great about canine rehab.
Yeah,
Every patient that's walking in is just, for the most part, happy to be there and ready to
sure.
get going. I think that
Yeah,
was one of the big things of transitioning from human to,
yeah,
animal is the differential in your patient coming in and the attitude that they
yeah,
have when they're
definitely.
coming in. But, let's talk about some possible recent, like, advancements or even
Mhm.
research going on with manual therapy that could be out there. Because again, a lot of this stuff is
Mhm.
coming from the human world and
Right,
translating into canine rehab. So,
right.
yeah, what are your kind of insights or updates on that?
Yeah, and you're right. So much of this we've taken from the human world and adapted to the animals, and we're just starting really with a lot of starting to look at research to prove that
Yeah.
this is what works, and from anything from better weight bearing to, of course, we can look at goniometric range of motion
Mhm.
improvements and function and all of that. Just starting, there's some research coming down the pike looking at some of these functional improvement scores.
Yeah.
Not only like owner perception, but movements, incorporating dynamic gait analysis, force plate, and all of that other
Yeah.
stuff. And from finite movements to like agility dogs to then looking at more of older dogs and that sort of stuff and
Yeah.
spinal movement and that. So we still have a long way to go, but with we're getting there, and I'm hoping, like I always say, like, this program is a stepping stone, like, to learn more because I love
Always.
that
Yeah.
students come in and they're like, "Oh, I didn't even know this was manual therapy, but we're doing this." I'm like, "That's
Mhm.
great, and let's refine it a little bit more, and now let's try to think about even if it's a case study for research and get that
Yeah.
in there, that's incredible." Writing up just students have to submit cases, and some of those are just awesome. It can go to be published and all of that.
Yeah. No, it's pretty cool. And like I said before, techniques from the human world going into the canine rehab world, like Mackenzie and
Mhm.
Mulligan, and even just the instrument assisted soft tissue
Yeah,
mobilization, right?
yeah.
I think that's been growing hugely. Still a lot to learn there
Mhm.
because with your patient, the fur, all that fun stuff. There's so many things just, helping us advance from the human world and translating from the human world that there's just so many tools just in manual therapy. And
Yeah.
I think it's really important to, just put it out there that it's huge for your professional development. And I think training in it, like this kind of course, where, like you said, it refines it, right? You're roughing your edges
Right.
on manual therapy and at the end of the day, I think you can agree that when you're doing physical therapy, you just need the tools in front of you,
Mhm.
right? Your hands.
Yep.
I think it's huge that providers, practitioners, things like that really go into this course and think about this being the most important thing
Mhm.
more than running to an underwater treadmill
Right.
or a laser.
Right.
The tools are fun, right? Those modalities are fun, but these are the things that are really going to get you there.
Absolutely.
It's your hands. It's your hands. So I think that's a key kind of takeaway
Yeah,
when it
absolutely.
comes to manual therapy. Yeah.
I always laugh that I've been doing this for a long time, and way back when, we really didn't have anything. So it was
Yeah.
just hands-on, and very often people will say, "Oh, I don't know if I can do rehab because I don't have the space or the resources." Like, you totally can. Well, like, you could start with it, and I always encourage this program, even if people are not maybe they don't wanna go into this all of the time, but
Mhm.
it helps with your palpation skills. It helps with just being a better practitioner in so many ways, learning, and sometimes you just need that little push of a mobilization or a manual technique to help, and it's always
Yeah. Yeah, absolutely. Especially people brand new into it, their first year, or especially, I would say, from the vet world too, veterinarians and vet techs. I know they're not really well trained in
Mhm.
using their hands that way sometimes.
Right.
So
Yeah.
there is an advantage when you come from the PT world because obviously we practice that. Super huge for the veterinary side as well. I did go off of the course a little bit, and I just wanted you to maybe give an outline or phases of how you go through the course, what your days consist of, how you guys begin,
Yeah.
your middle, and how you end as well.
Yeah, so definitely. So during the first day, we review a lot of the online information in the first hour or two and go over some of that palpation, especially the blindfolded
Yeah,
palpation.
I like that a
um,
lot.
but practice some of the massage, a little bit of the myofascial stuff that we go over, and
Mhm.
then really start working on the second portion of day one on beginning and recognizing joint movements, normal end feels, abnormal end feels, because we always have some abnormal dogs there. And begin also, we have everyone pair up with a partner and mobilize each other. So you get to kind
Yes,
of feel things. And like I always
yes.
joke when we have new equipment in the facility, everyone's got to use it. So you
Right?
learn what the great, the bad, and the ugly is. Same thing with mobilization, because I think I always laugh, people either death grip or they don't their hand position is wrong and all of that. Just going over it sounds so simple, but working on that, and then
Yeah,
we start with some mobilizations, and day 2 is all about the different mobilizations. We split it up into forelimb, hind limb, spine, um
mhm,
which takes people are usually excited but worn out.
mhm. Yeah,
And we have small groups, so it's nice that we can spend a lot of time and a lot of guidance. And day 3, we start going over the mulligan techniques. Yeah, so able to do that, and, then we go over live cases and how would you treat, and we have a lot of game playing and make it fun.
yeah.
There's The group is, of course, mixed. So there's PTs, there's PT assistants, there's vet techs, and
Mm,
everyone to me is a student at that point. Like everyone's bringing a little bit more or
yeah,
less of experience. And so I always laugh. You're just Anthony. You're not anything else.
yeah,
And we're going to like work through it together. And some of the games that we play is, just like a name out of a hat, and you're going to work together and we're going to palpate something and treat it. And so a lot of kind of putting it all together that last day and how this fits in. And yeah, we have a lot of fun. I always
yeah,
find that the groups are because we're sharing so much together, so much time together. And they're always like, I always remember each group and just the fun things that we've done and, that
yeah.
yeah.
Yeah, I'm sure the experiences are unique, and I'm
Mhm.
sure that last day too has a bunch of excitement, but
Yeah.
nervousness for the
Yeah.
students.
Yeah.
Um,
Absolutely. Absolutely.
I do like that picking out of the hat or
Mhm.
spinning a wheel, see
Yeah.
what happens,
Exactly.
right?
Okay, who's gonna have to do this?
Right.
And everyone knows it. Everyone
Yeah.
knows how to palpate, but it's just, figuring it
Yeah.
out. And the same thing with mobilizations. And practice makes perfect. And the more you
Absolutely.
practice,
And
the easier it
uh,
is.
and even in the human world, there was always those coworkers or
Mhm.
colleagues or students
Mhm.
when you were in school that just had the kung fu grip, and
Exactly, exactly. I'm like, if you're
it's
white
like,
playing, not good. Because
yeah, or if your patient's turning purple in the
right,
area,
exactly,
not good.
exactly. Yeah,
Don't be a tourniquet.
right,
Don't be a tourniquet.
right. And the dogs are not they're not gonna be silent. They're gonna do something. So,
Yeah. No, yeah, they are very true in their body language.
abs
They're either gonna be submissive or let you know that, "Yeah, that doesn't feel good,
yeah,
so get off me."
yeah, without a doubt, without a
Um,
doubt.
but yeah, and that's what's great about manual therapy is that it could really be such a pathway
Mhm,
to success
mhm,
in the optimal functional goal of your patient.
right,
So that's really cool. And it's really cool to get some insight on how the course works for
yeah,
sure. I want to thank you, Deb. This was, like I said, insightful. And I definitely think our listeners got a really couple of, or even a bunch of tidbits out
good,
of this.
good.
Um, Outside of that, I know there's some other projects in the works with you with the CCAT program. I don't know if
Always.
you want I don't know if you wanna drop the bomb now or we can always do a teaser later.
Always to drop the bomb, right? We're getting
I'll let you do the honors.
are completely revamping our business course. So
That's very exciting, yes.
you and I have the pleasure of doing that together, which will be awesome.
Yes.
I'm excited and it'll be
Yeah, no.
spectacular.
I, no, I'm very honored to do it with you for sure. I remember going through the course and looking back at one of the things you had provided in the earlier years, and it was very insightful.
Yeah.
I can tell you the years that I have under business ownership, your guidance was included in that. So it was very helpful. And yeah, I think it's super important to have something like this because a lot of
Like,
graduates, alumni are always asking after the certification, what now? So
absolutely. And thank you. And I'm honored to work with you too. I think it'll be fun. It'll be
yeah, absolutely.
a lot.
Yes, we'll get more into it when the
Yep,
time is ready, that's for sure.
absolutely.
But
Absolutely.
Deb, I appreciate it,
No, thank
and
you.
we'll talk soon.
Okay. Sounds good.
All right. You've been listening to the Canine Rehab Movement Podcast. Thank you for tuning in. And for more information about our programs, please visit ncsuvetse.com. That's ncsuvetse.com. And for those of you who've made it to the end of the podcast, use the discount code NCSU100 and save $100 off of any course, $4.99 or more. Until next time, guys, this is the Canine Rehab Movement Podcast.